Evening. So yeah, Facebook and YouTube are live. Just don't know why I'm not being able to go live on Instagram. I'm just looking at other people's stuff on Instagram there because I was trying to go live on my own Instagram, but I can't. So anyway, I think that Facebook and YouTube are working. I hope it is. It's Tuesday night. I've got some questions. If you've got any questions for me, then please feel free to let me know what they are. Here we go. I'm going to get started if that's okay. I had breast implants abroad in February, but now I have a hole appear underneath the one breast. The NHS has said I need to go private to have it sorted, but no clinic will help me. Yeah, this is a problem. And I unfortunately can kind of understand. I'll be honest with you, I can see it from both sides. I can see why people go abroad for surgery. Absolutely, I can. I think it's significantly cheaper than the UK, and it can seem attractive. And sometimes I wonder if the kind of, not the problem, but the issue is we are not explaining to people the kind of service we offer. I don't know what sort of service they offer abroad, so I can't say that we're doing a better service than they offer abroad. But what we should be saying is what sort of service we offer in order to let people make an informed decision. Because if we don't tell people what sort of service we offer, they're just going to go on price. Anyone would. It's completely natural. If you say, do you want this thing or that thing, and this thing is cheaper than that thing, and there's no tangible difference between the two, you're going to go with the cheap one. I would, you would, everybody would. So I do think that we need to do a kind of better job of explaining what sort of service we offer, because I see this. I do see this. I do see people who have gone abroad for surgery and can't get help, and it's very difficult because I always say to patients, look, when you pay for the surgery, you're not just paying for that 1 hour in the operating theatre if you're having a breast augmentation or whatever surgery you're having. You're paying for the whole package, and you've got to ask yourself, how can some people afford to be so much cheaper? There's got to be a question there. Is it really the same? Am I getting the same thing for so much cheaper, or is there something else going on? Because we do hear stories of people who struggle to get help post-operatively. And, speaking personally from my own practice, a huge part of my practice is seeing people post-operatively. I only spend a very small proportion of my week operating, but obviously, therefore, I need to earn a certain amount of money from those operations because I'm only operating a very small part of my week. The rest of the week is looking after people and seeing people in clinic. If I've got a different business model, and I know that some places work more on a business model where let's get the surgeons working all day, every day, and not really seeing their post-ops, then you can earn the same amount of money because you're operating, 3, 4, 5 days a week, as opposed to me, who's operating, 1 day a month. So you can charge a lot less because you're doing a lot more operations. And so in a given week, you'd earn the same amount of money. But I wonder if then when one of those tens or hundreds of patients that you're operating on develops a problem, you may not have the time to deal with them. That doesn't help that patient with the problem. So, the message really needs to get out to patients pre-operatively so that they can make a decision on what they do, so they don't get a shock post-operatively, because we often see people who get a shock post-operatively who have a problem like this and then come into me or other people and say, look, I need help. And we'll be like, no, I've got my own patients to look after. I don't just offer an aftercare service. My price includes the whole lot. You can't just sort of buy the aftercare service. So it is extremely difficult for patients who have got a problem, having had surgery by a surgeon who's not looking after them, which is the implication here, that their surgeon isn't looking after them. I'm assuming that they can't go back to their original surgeon, because that's what is always the advice, is to go back to your original surgeon. Now, the NHS will help if you've got an overtly infected implant that's red and angry and you're ill. But if you've just got a sort of niggling problem, then, you know, often the NHS won't help. And this is a problem. You've got a hole underneath one breast after a breast augmentation. That is a serious problem, and you need help. But yeah, I don't think there's any answer to. Well, the answer to this is go back to your surgeon. That is the answer. Your surgeon has a duty of care to look after you. In this country, particularly if a BARPS or BAPRAS member, we've all got a code of conduct, and if we're not looking after our patients, we will be, you know, you can go to the BARPS or the BAPRAS or whatever, and the GMC, and goodness knows who else you can go to. And you know, there's certainly plenty of ports of call to complain if you're not being looked after. But I don't know what it's like in other countries, and it's a real problem, and I haven't got an answer for it, except to say we need to educate people to ask questions pre-operatively. What if I have a problem post-operatively? Because I've spoken to people who've been told to go and see their GP if they have a post-op problem, which isn't great, really, because the GP's got other things to do. They're not really specialists in this sort of thing. And, you know, quite frankly, if you've got a surgical problem, you don't really expect the GP to help you for a problem created by a surgeon. So, yeah, that's a sad one to start with. It's a bit of a downer to start with there, but that is the problem with kind of, it's a bit like insurance, isn't it? I often think it's a bit like insurance. And I don't think the insurance companies do a good job of this either, because I don't know about you, I think most of us choose insurance based on price. We look for the cheapest whatever, you know, compare the market or whatever, get the cheapest insurance. But really, what they should be doing is saying, look, we will really look after you, because all too often you do your insurance and then you find they don't look after you, you're not covered, but you've gone for the rock bottom insurance policy, which, why do you think it's rock bottom? You know, so but again, I don't believe insurance companies do a very good job of explaining why one insurance policy is more than others, because you can get quite a vast range of prices for insurance policies. And as I say, most people, if they haven't got a good reason for paying more money, is going to go for the cheapest. But and then, you know, what kind of not what you expect, but, you know, you only when you realize you need to claim, and then you realize, crumbs, they're rubbish, I'm not going with them again, and then you don't go with them, and then you go with the second cheapest, you know, and then so it goes on. Or maybe you're looking a bit more into detail of what they offer, but you only do that when you've got a problem. And I think that's why these places exist, because you know, the vast majority of people don't get problems, and so there are a lot of people who've gone and paid a lot less and actually been okay. So, you know, it's only when you get a problem you realize why you pay what you pay. So so yeah, long time no see. Kimberly, hello, how are you? Nice to see you. Got your shades on there, very good. How's it going? Hope you're well. Looking at myself in this video, I look like I need a haircut, don't I? I mean, look at that wispy hair up there. That's not good, is it? Oh, heck, what we got here? If you have a surface layer of necrosis where the skin was stretched beyond its blood supply, will this affect long-term scarring, or will it eventually be okay as it's only the surface layer? Good question. Well, it depends. It depends on the depth of necrosis. So if it's full thickness necrosis, and to be honest with you, using the word necrosis kind of implies full thickness. So if it's kind of like pink, if the skin looks really pink, maybe blistered, you know, you might be all right. But if it's kind of like darker than pink, if it's purple, or if it's black, that suggests full thickness necrosis, and the scarring will be wider than we would like. So if it's just kind of pink, and if it's just a bit of blistering and superficial sloughing of the skin, we kind of wouldn't use the term necrosis. So, just by the fact that you're using the term necrosis suggests full thickness layer of skin dying as opposed to just the superficial layers of the skin dying. And if it's full thickness of the skin dying, then that would make the scar wider when it heals. It'll take a bit longer to heal, and the scar will be a bit wider. But having on the bright side, often it doesn't look too bad. I mean, when you have the necrosis, if you have a black bit of skin somewhere, obviously that looks really bad and can be quite alarming. But then it can form a scab, and it might actually be okay. So I wouldn't lose too much hope. It might. I mean, it depends I don't even know what part of the body we're dealing with. I don't know if we've got implants involved, because that's a different level of complexity. If there's implants involved, be more worried about it. But in general terms, skin necrosis is a little bit of a fact of life in plastic surgery, because a lot of the stuff we do is closed tight. Obviously, we always try and avoid it, but it can happen in the sort of operations we do. Tummy tucks, facelifts, breast lifts, they're all closed tight, so there is a risk of the skin dying. But as I say, it often doesn't need anything. It often heals satisfactorily, but needs to be carefully looked at and looked after to make sure it doesn't get infected and what have you. Kimberly is good. That's nice to see you, Kimberly. And you know what, Kimberly, I will say thank you for commenting, because I think it makes me look good in the Facebook world. What is the downtime of having a mole removed? Now, I got in trouble when I did the video on cost of mole removal. I didn't get in trouble, but I got a lot of negative comments. I did a video on this on YouTube, and everyone was saying, yes, clickbait, because you haven't said what the cost of mole removal is. Because I think I got asked the question, what's the cost of mole removal? And the fact of the matter is, it can vary. It can vary on the size and the site, and you can get big moles. You can get quite large nevi. So not all moles are just tiny little moles. So, the point is, it's the same for the downtime. So if it's a tiny little mole with a couple of little stitches, not great, not a huge. If it's quite a big mole and it's closed quite tight, and the skin's like, then it'll be longer. But in general terms, I'll tell you in general terms to be helpful. In general terms, you will have stitches in if it's the face. Well, you'll have stitches in wherever. You'll have stitches in that need to be removed in the face. On the body, we tend to use dissolvable sutures. And so on the face, the stitches will be removed after 5 to 7 days. And the skin will be healed in that time. So the outer layer of the skin will be healed in 5 to 7 days on the face. It takes a bit longer on the body for the skin to heal, 1 to 2 weeks. Therefore, because the stitches need to be left a bit longer on the body, we tend not to use the non-dissolvable sutures, because they can leave stitch marks. So we tend to bury a dissolvable suture so there's no stitch marks on the body, but it does mean that the scar is a bit more red while the stitch is dissolving on the face. So using the non-dissolvable sutures does give you a slightly better scar. That's why we tend to use them on the face and then remove them at 5 to 7 days. So you'll have a dressing on, usually if it's on the body, or stitches on in the face. So after a week, the dressing comes off, the stitches come out. So after a week, you don't have any dressing or anything like that. And the skin will be healed, so you will be able to do, you'll be able to do stuff straight away. Next day, that afternoon, you'll be able to do, well, might feel a bit like that afternoon might be a bit extreme, but certainly the next day you'll be able to do stuff. But you might, if it's on the visible place, you might feel a bit self-conscious about it, but you want to take it easy. Certainly for the first 1 to 2 weeks. As I say, the skin should be healed in 1 to 2 weeks. Sometimes it takes longer, but normally speaking, 1 to 2 weeks, you kind of want to be taking it easy in terms of jogging, running, weightlifting, gym, and all that sort of stuff. You can do gentle stuff like walking. After a couple of weeks, once the wound healed, and we'll probably be in touch with you, because we will see you in the dressing clinic to check it's all healed up okay. You can start getting into things, but you want to start gentle and build up. If it's on your face, you don't want to sort of make your face go red. So any sort of like weightlifting and stuff, don't really want to do that, because you make it bleed and that stuff like that. And then personally, I normally get you massaging it after about 6 weeks. So the downtime for having a mole removal is kind of like the day of the op is the downtime. I would say the next day you'll be able to get back to work and stuff. But although as long as you're happy having stitches in, and as long as you're not doing heavy lifting. If you're doing heavy lifting, it'll be a couple of weeks. There you go. Could have said that just at the beginning, couldn't I? Kerry, what you got? I had a mini tummy tuck in November. Can I do laser or a hair removal over the scar now, 6 months on? Yeah. Yes, you can, Kerry. Well, fine by me. I don't do the laser hair removal, so you better check with a laser hair removal person. But absolutely fine. Yeah, 6 months. Good amount of time. I'm assuming it's all healed and it's all right. But yeah, you should be absolutely fine as far as I'm concerned. Kerry, you have my blessing. You can have a laser or hair removal. You know what? Amy should tell me what question she's putting on here, really, rightfully, so that I don't sit here and get a question that says, do we offer Aqualyx treatment? Now, well, I can ask that question in that the answer is no. What is Aqualyx treatment? What is it? Is it one of those fat dissolving treatment? What is Aqualyx? I don't know what Aqualyx is. I've got to be honest with you. I, rightly or wrongly, personally, I'm a surgeon and I do surgery stuff, and I'm not very good at all the non-surgical things. I've got my own clinic and I know I should do all the non-surgical things. People say, oh, you've got to do all the non-surgical things. I don't know. This is one of those non-surgical things. So it's not really, I just don't see it as my area of expertise. So what is it? Some kind of fat? I'm guessing it's a fat. Aqua, so that's water. Lyx is like lies, isn't it? Like break up water treatment. I don't know what it is. Anyway, I don't do it. No, I don't do it. Sorry. Look at an Aqualyx specialist in your area. I'm terribly sorry. I'm not that guy. Can I have an on-block total capsulectomy if I have obstructive sleep apnea diagnosis and CPAP issues? Okay. Kind of like, I find a lot of these answers, a lot of these questions, I kind of say it depends, but I think that's because it's hard to give a straight answer. It's a bit, I remember when I worked in A&E, one of the nurses, when people rang up, people would ring up the A&E and say, what's the waiting time? And the nurse would always say, well, it depends. You know, if you've stubbed your toe, it's 4 hours, but if your heart stopped beating, we'll see you straight away, sort of thing. You know, it kind of depends on what the problem is. And so this, in relevance to this question, it kind of depends why you need a non-block total capsulectomy. So if you need a non-block total capsulectomy because you've got cancer, well, yeah, you can have it. You know, your risks are increased if you've got of having an anesthetic if you've got obstructive sleep apnea and you're using CPAP. So the risks are increased of post-op respiratory problems. So you know, but then they are not absolute contraindications. So it would depend on the indication for the surgery as to whether the complications associated with your sleep apnea outweigh the risks outweigh the benefits or not. And really, it's an anesthetic issue. Well, I guess surgery as well in terms of the indication for the surgery. So the surgeon will be involved in terms of the indication for the surgery and the consequences of not having surgery. So you have to weigh up the consequences of not having surgery versus the consequences of potential complications of having surgery. So yeah, I would say not necessarily definite no, but it would need a discussion with the anaesthetist to see if the anaesthetist was happy. And in this day and age, we need to see if the hospital's happy as well. So check. It would certainly need discussion. It's not going to be straightforward if you've got CPAP. That's not straightforward at all. Lynn, can you still have a tummy tuck if you have a 5 centimeter scar above your belly button? So what we're looking at a horizontal scar, Lynn, or are we saying vertical up? So if you've got a vertical straight line up going up towards your rib cage, maybe. Well, the answer, Lynn, it's not ideal whichever way it is. It's not ideal, but if it's kind of going vertical up, so straight, if it's going down the midline, it's kind of better, I guess. As long as it's an old scar, you'd want it to be a really old scar because you'd want to have as much blood supply going through the scar as possible. But it would affect how much we can pull down the tummy tuck flap, and it would affect the blood supply of the healing of the tummy tuck wound. So it would have an effect. If it's a horizontal scar, like going across 5 centimeters above your belly button, I would say that is a no. It wouldn't be possible to do a tummy tuck if you have a horizontal scar above your belly in your upper abdomen. Personally, I would say that is a contraindication to having a tummy tuck. Oh, here we go. No vertical, 5 years old. Okay, so it's a vertical scar. Yeah. Okay. Well, vertical scar. Yeah. In that case, you can still have a tummy tuck, Lynn, but it would not. It's not great. I mean, it would affect the tummy tuck. It would affect. We'd have to see if you've got enough skin laxity to bring it down. But it would also mean that is always the tightest point centrally, and that's not going to pull as well as it would if there wasn't a scar there. So it's not good, but it's not an absolute contraindication. You could still have it, but it would mean that we would be limited as to how much we could pull down. Plus, it would affect the healing of the skin. So you've got an increased risk of wound healing problems, which is always an issue with a tummy tuck, wound healing problems centrally. But it'd be even worse if you have that scar. So not ideal, Lynn, not ideal, but it is what it is. So it's not a 100% deal breaker, but it's not ideal for a tummy tuck. Do we offer Alar base reduction? So I don't know if the viewers at home know what an Alar base reduction is. So Alar is the bit here. You call the Alar cartilages, these cartilages here, on your nose. So yeah, no, we don't. Well, I don't. It's someone who does rhinoplasty, just taking a wedge out of the Alar base and making the Alar, the nostrils, a little smaller. So it's for sure it's a thing, but I don't do facial aesthetic surgery, so I'm going to say no to that. I don't know if Costas would do it, but just generally speaking, no. It's kind of like a facial kind of thing. Can you have a breast reduction under Twilight Anaesthesia? Yes, you can. Yes, you can. I mean, like a really bit. I mean, bottom line is, yeah, you can have a breast reduction under Twilight. Personally, it's a very personal thing. This, I think you'll find plastic surgeons actually are not united on this, and I think some will say, yeah, brilliant, fantastic, do them all under Twilight, it's great. Some will say, no chance, never do them under Twilight. And some are like me and say, yeah, as long as it's not too big. I mean, personally, if it's a really big breast reduction, I would think I would struggle with it under Twilight, and not well. You, the patient would struggle, and I would struggle, and everyone would struggle. So for me, it's kind of like smaller breast reductions, breast lifts. Twilight's gone through quite a journey with Twilight, with my practice. So never did it at all, or hardly ever did it. COVID came, couldn't do GA. Hospitals all said, we don't want you anymore. So kind of had to work in places where they only did Twilight. Went really well, thought fantastic, love it. Twilight's great, went really well. I think the thing was the patients were very keen for it, and also the anaesthetists were very good at it, which makes a big difference. Hospitals then said, oh, you can come back now. So we went back to the hospitals and tend to not use it so much. Anaesthetists saying, oh, the airway's not controlled, and might as well do GA because you're so deeply sedated with the Twilight. So often the anaesthetists are like, they'll do it, but they're like, what's the point type of thing. So yeah, gone around a bit of a full circle with Twilight. So if you are sort of got a reason for it, fine, but often GA, sort of reverting back to GA now. And I've often thought, if Twilight was so good, why don't the hospitals where they can do GA, why don't they do more Twilight? Why is it only in places that they can only do Twilight? But I'm not, I don't want to be too negative about it, because we did have good experience with it, but don't do it quite so much now, how we work in the hospitals. So well, nice to see you, Kimberly, Kerry, and Lynn. Nice to see you here today. I'm gonna do this again next Tuesday, because I've had so much fun today. 7 o'clock Tuesday night. think I am. I don't think it's not holiday, is it? Is it half term or anything like that? I don't think it is. So see you then. And I often do this on Instagram, but it's not working at the moment, which is a bit upsetting. Well, upsetting is a bit of a strong term. It's not upsetting. But yeah, if you've got any questions, and but if you're watching this on catch up, feel free to put it in the comments below, and I will answer them at next week's Q&A. Thank you all for your participation and input with the questions, both live and pre-recorded. And I bid you good night and sweet dreams.